Hi, everyone. Thanks for your time. Today, we managed to steal some valuable time from Dr. Akshat to talk about bone health. Now, we've spoken about this topic, over and over again, but I think it's about time that, we understand that there are a lot of people who are overdosing on calcium, or a lot of people who are, deficient in calcium and vitamin D3. And at the end of the day, our bones are so important for us. We may not realize it when we're in our 20s and our 30s and our 40s until the pains start happening or until there's irreversible damage. And we have people who are aging with osteoporosis, aging with, brittle bones. And then that actually decreases your quality of life because, at the end of the day, when you have a fall, we all know people who have had a fall in the age of 60s and 70s, and some of them never recover from the fractures and all of that stuff. So when these things can be prevented, why not? We have to do things the right way. You see, India and the US are the highest consumers of calcium products and dairy products, okay, for the longest time. And India and the US have the highest amount of osteoporosis. So by now, you would have realized that there is no real connection. You can't just go on taking calcium expecting your bones to get better without looking at your vitamin K2, without looking at your vitamin D3, which helps you absorb calcium. So people take calcium, but they're low on D3. So a lot of that calcium is getting absorbed. A lot of people in our country, maybe 1 in 5 people suffer from acidity. If you're acidic, your blood basically leaches calcium from the bones to make the blood more alkaline because it's highly acidic. So we need to understand there are various causes, and just popping calcium is a big issue because we have a lot of clients who end up with kidney stones because of, the overconsumption of calcium, and kidney issues as well. Because whatever's excess in the body has to be flushed out. If it can't, it starts forming stones in the kidney and all of that stuff. So we have Dr. Akshat with us today. Dr. Akshat, thank you so much for your time. Let's start off from a medical perspective. Why are bones so important for people? And can you explain the importance of calcium as well when it comes to the musculoskeletal system?
Hi, Luke. Thank you so much. I think this is a very, very important topic, and it's something which is very close to my heart because I honestly feel bones are very, very important. They don't get the enough, importance that they deserve. And in fact, they're so important that we ignore the fact that how damaged they can actually get, So just to kind of understand what is the musculoskeletal system. So musculoskeletal, basically you have your bones, you have your muscles. There are two main prominent, parts of it. But you always also have things like tendons, you have ligaments, you have cartilage, you have the joints, where the bones kind of come together, which make us move basically. But today we're going to concentrate more on muscles and bones, okay? We look at the ligaments and all a little later. But what is important when it comes to bones, we have to understand that it's constantly changing. So our bone mass is constantly changing, all right? There's something called as remodeling. What is remodeling? So there's a bone, okay? So there is formation of new bone, which keeps happening. And there is breaking down, there's a breakdown of the old bone, okay? So this process is basically remodeling. It's very, very important. But what happens is as kids, as children, the important thing is the formation of new bone is more than the breakdown of the old bone, all right? So this is something which restores our bone mass. And then finally, by the age of 30, around about 30 is where we reach our peak bone mass, okay? After that, the process changes a little bit. You still form rebone, you still form new bone, but the process is slower than the breakdown. So the breakdown of the old bone becomes faster and the new bone formation becomes slower. As we go through the years and years and years, this process, the new bone becomes lesser and lesser and the old bone breakdown becomes faster and faster. So what's happening is by the time, the minute we cross 30, we start to lose our bone mass. So the thickness, the density of our bones starts to reduce, okay? This process even speeds up after for a woman, let's say when they cross menopause. So what is menopause? You have no menses for 1 year, okay? No menses for 1 year, you've gone into menopause. That speeds up the process of the breakdown of the bone, okay? Then second is for men. So it's not that men are completely, there's a myth that men are absolutely, they have great bones and nothing can destroy them. But that's not true. Especially for aging men above 60, 65, 70 years of age, they're equivalent. They're as bad as, anybody going through menopause. So even men need to be extremely careful. So this entire process is remodeling is extremely important. And we need to understand that the minute we reach 30, this process changes. So breakdown is faster and formation is slower, okay? Now, what is the role of a bone? I mean, it's so obvious, right? It makes us move, it makes us stand, it makes us walk. Okay, imagine the minute we get a fracture, we don't move that part at all. It goes into a cast. You are not allowed to move it at all. It could be your hand, your wrist, your toes, anything, your spine, your hips. But when this fracture happens at an older age, exactly what you said, the recovery from that is very, very difficult. And some older people don't even recover from that. Okay, so that's extremely important because the capacity to heal also goes down with our age, especially if you've not led a good lifestyle. Okay, so that's one. Second is it protects us. It protects our vital organs. Your skull protects your brain. Your ribs protect your heart. So it's very important that these bones stay intact. Okay. Third is there's something called as a bone marrow. Two types of bone marrows. It's like a fluid, like a liquid inside your bones. Okay. It's in between the bones basically. So there's a red marrow and a yellow marrow. Red marrow, in fact, is responsible for making your blood cells. You talk about your RBC, you talk about your WBCs, your immunity basically is by WBCs, right? So that's responsible for making your WBCs, blood cells. Then you talk about the yellow marrow. These have actually, they are reservoirs of energy. They actually help you store some energy in case, you're lacking. So very important is to have your bones. Last but not the least is they are minerals of calcium and phosphorus, which are again responsible for the bone mass. But they actually, when you're lacking calcium, suppose your bone calcium your blood calcium goes down, the bone calcium is actually leached out so that the blood calcium is restored, because the blood calcium is what is important. If your blood calcium starts to go down, that's when you start getting symptoms. That's when you're going into hypocalcemia. So that your body is so intelligent, it's made that way that it will help you remove it from the bones so that the blood maintains itself. So it's extremely important. So imagine if your bone mass is already less, you don't have enough calcium coming into it. Your body is constantly pulling calcium out of the bones just to keep the blood calcium normal. So you got to understand that you can't fidget with your bone mass at all. You want to make sure that it's absolutely fine.
That's a great explanation, Dr. Akshat. To add two more points to that. So, that's why such a diverse diet is also important. You just don't have to go on taking calcium, because phosphorus, which is a trace mineral, we need it in small amounts, but the bone matrix cannot function without phosphorus. And phosphorus is what you get in, if you're non-vegetarian, you'll get it in seafood. If you're vegetarian, you're going to find it in brightly colored fruits and vegetables, almonds, walnuts. So you see, it's so important for us to have a diverse diet, because we can lack even just a little bit of phosphorus and cause this problem. And if we take it a step ahead, when it even comes to the immune system, your bones and your immune system are directly connected. Even stem cell generation and stem cell regeneration occurs in the bones. We have to understand that. So for people who are going through cancer, people who are looking at the prevention of diseases, genetic disorders, or when you have an issue with your stem cells, we have to understand that your bone health plays a huge role in your stem cell regeneration, because it happens there. Your bones contain all of this, and in a time of crisis, it's like, they allow all of, everything to come out from there. The RBCs, every single immune factor originates in the bone, and that's how important it is. So what about calcium, Dr. Akshat? What's your advice to people? The importance of calcium, how do they manage it? Should they take calcium drugs all the time? Postmenopausal women as well. These are the most general questions. Can you answer that from a medical perspective, please?
Okay. So whenever we say calcium, we should actually say vitamin D and calcium, because they're literally inseparable. You can't separate the two. Okay. So imagine a person is low, or assuming that the person is low on calcium, because you have to understand, how do we understand, whether you're deficient in calcium? Because that's one of the trickiest parts. Okay. There are two types. One is the bone calcium, what I mentioned, and one is the blood calcium. Okay. Normally, because the leach is happening from the bones, the blood calcium doesn't show, very low values. It can be a little low, but not too low. If you've gone too low, you will have some symptom. And when you talk about symptoms, it could be very vague, because again, mostly vitamin D and calcium mimic each other. Okay. So you talk about extreme fatigue, you have aches and pains in the body, you have muscle cramps, you have brittle nails. Then there's this, this white line which used to appear. I remember as a kid, I used to have that constantly. I used to have it. Yeah. Someone used to say it's calcium. Someone used to say it's zinc. Bottom line is, it is one of the, deficiencies of calcium also. Then you talk about teeth problems, constant teeth problems, because calcium is very, very important for the proper growth and, the development of the teeth also. So if you're having any of these issues, sometimes your fingers go into cramps. It's like a spasm, basically. This could also be a deficiency of calcium. Okay. So just because your blood calcium is coming correct, that doesn't mean you have enough calcium in the body. Okay. So we have to understand that. because of that, now you have, so how do you, now once you know, suppose you assume that there is, you kind of, have few of these symptoms, okay, and you've kind of decided that there is calcium deficiency, you're by yourself. If you're doing anything by yourself, you're not going to take any form of supplements. It doesn't matter what age you're at, okay. Go find your nutrition. Now, if you're lactose intolerant, or you have gut issues, and for some reason, so dairy is the highest source of calcium, which is, we can't debate that. It is the highest source of calcium. But is dairy meant for you is a question mark. So we can't get into a debate who should have dairy and who should not, or whether we should or not. If you have good quality, A2 milk or organic, and we trust the vendor, we have our own cows, probably, a bowl of curd, a glass of milk, whatever suits you, buttermilk, probably that's good to go. But otherwise, you have to look at the non-dairy sources, whether you're looking at green leafy vegetables, you're looking at the rajmas and cholas, and like a hummus or something. Seeds, you have sesame seeds, you have poppy seeds, you have chia seeds. These are the things that you want to look at, but you have to try and get as much as it from nutrition. That's very, very important. Your diet needs to be calcium. It has to have enough calcium, because even if you go, you take a supplement. So technically, you need 1000 mg of calcium every day. You need 1000 mg of calcium every day, and you need about 1000 to 2000 international units of vitamin D every day to absorb that calcium. You need a little bit of vitamin, you need a little bit of K2, vitamin K2, and you need a little bit of magnesium, a little bit of phosphorus, which is very easily available in the diet. When we talk about calcium and vitamin D, so vitamin D, we've constantly spoken about this. You can get your sunlight, you can have your egg yolk, you can have your mushrooms, but if you're still deficient, please take a supplement, okay? Don't do it yourself. Don't not self-supplement, whether it's vitamin D or calcium. Do not, because things like the way you said, kidney stones. Yes, you're prone to get kidney stones. So ideally, at one time, even if you take a calcium supplement, you should not take more than 500 mg of calcium supplement, okay? Whether it's citrate or carbonate, it doesn't matter. The elemental calcium cannot go over 500 mg, because that's the only capacity of the body to absorb. So that is one thing, very, very careful. Plus, all these supplements can have some or the other interaction with the medications that you're taking. So if you are on any medication, you have to keep your doctors in the loop, okay? So always discuss this. Now, let's say that you've gone into menopause, okay? Suppose you have thyroid, it's too high, too low, you fidget with your medications, and the TSH is out of control. Your senior citizens, kids, okay, now this is a very, very problematic area. Kids don't play anymore, they don't hang, they don't fall, they don't play, they don't run.
If they don't get sunlight.
Yeah. Exactly, there's no sunlight, so forget about that also. So if your kid is sitting on, and now thanks to the lockdown and the COVID, we've gone even into online schools, so if you're sitting in front of the screen because we can't help it, and there is absolutely no playing, no sunlight, then probably a little bit of supplementation, keeping a pediatrician in the loop might be necessary for kids also, okay?
I agree to that.
Because,
yeah.
And like I keep saying, 30, if your kid is not going to get his bone mass by the age of 30, your reservoir is less. He's going to fall, he or she is going to fall into trouble earlier than even you might have fallen, Any person with family history of osteoporosis. Now, what is osteoporosis? So there are stages. One is a normal bone. There's something called as osteopenia. That's the stage where your bones have started weakening, and then finally you've gone into osteoporosis, okay? How do you find that out? Again, it's not going to be in your blood calcium. You want to do something called as BMD, that's bone mineral densitometry, DEXA scan, okay? That's how it's done. But please, again, you cannot, and especially now with the COVID and everything, you're not going to go walk into a lab and get it done. It doesn't work like that. It is radiation. It has radiation. So if you want to get it done, you need a prescription from the doctor who's going to assess and analyze your report and tell you what needs to be done next, okay? There are medications for osteoporosis also, but you're not going to do anything yourself. You need an endocrinologist, okay? So there's another myth that if there's osteoporosis, you need to go to ortho. No, you need to go to an endocrine who will actually help you better than, of course, I mean, it's not that the orthos can't help you, but ideally the endocrinologist should be able to help you. So my sincere thing would be that if you want to supplement, keep your doctors in the loop. First is check your diet, okay? Check your diet, check your sources. If you feel you're deficient, go in for a supplement, but you got to talk. And it's not only calcium, it's D and calcium. You want to check your vitamin D because blood vitamin D is required. So if you're deficient in vitamin D, correct that. At the same time, calcium supplementation. And you want to make sure at least 2, maybe 2.5 liters of water to flush that calcium out is extremely, extremely important.
Thanks, Dr. Akshat. Now what kind of brings on bone the wasting away of bones more quicker. Like I know for sure, certain cancers patients are on estrogen blockers, and the bone health starts deteriorating. Males with prostate cancers, their testosterone is suppressed and that affects it. So certain hormonal conditions can kind of expedite bone disorders and stuff like that.
Right.
What else is there, and how do people know that, like, if I'm on a particular medication, I should be on the lookout or work with my doctors to look after my bone health? Because currently healthcare is in such a way that we treat the symptom, but we don't look after the side effects, which is very, very important. So what are some of the other conditions that people should be aware of?
Correct. So the way you rightly said, the people going through cancer treatments, okay, mostly they are given a injection maybe once in 6 months, once a year already, just to kind of, restore the bone mass, okay? But apart from that, people on steroids, okay, immunosuppressants, antacids, okay? Antacids is, I think, literally, I mean, it's sad, but I think 50-60% of the entire world is living on antacids. And that's so unnecessary, because if you can, at least find the cause. If you can find the cause and treat it, you might get off it, So unnecessary medication, you're talking about hormones, when your testosterone has gone down, your estrogen has gone down, you're talking about antidepressants, okay? You're talking about immunosuppressants, you're talking about antacids, you're talking about steroids. So these are the 4 main groups. Of course, the aromatase inhibitors, the way you spoke for breast cancer, which cuts off the estrogen, is also a part of the group. So these are the few 4 or 5 medications that you want to look at. And when you talk about immunosuppressant, you can talk about any autoimmune condition. You can talk about rheumatoid arthritis. You can talk about multiple sclerosis. All these people are on medication. So you want to look out for these, methotrexate, and you want to look out for these names. And if you're not on calcium or you're not having enough from the nutrition, talk to your doctor. That's the right time to do it. Okay.
Absolutely.
Apart from that, anybody not had a good lifestyle, 30 years of age, you've not done your part, you got to be on the lookout for sure. Okay. Second, just generally poor lifestyle. Okay. You're having too much alcohol, let's say about more than 7 drinks per week. You're in for bone trouble. You're in for bone trouble. Okay. Smoking, drug abuse, you're in for bone trouble. It just doesn't absorb, the body doesn't absorb the calcium, even if you're having enough. So I can't tell you, okay, you know what, have 2000 mg of calcium just because you're smoking. That's not going to work. That's not going to work at all. Fat diets, extreme diets, eating disorders. Your weight's too up or your weight's too down, or there's a yo-yo which is happening. You're in for trouble because your body doesn't absorb it. Your body's so confused. We've had patients who are actually losing weight now. It's not even about putting on weight. People are sitting and losing weight. It's not even worth it. The smaller you get, your size, your bones are shrinking, your muscles are going on the minute you start losing muscles. So you have to understand that your muscles are supporting your bones. If you start losing muscles, there's muscle loss, you're in for a lot of trouble, okay? Anybody who's gone through bariatric surgery, again, malabsorption can happen. It doesn't have to happen, but can happen. But you want to look at these things. Too much of belly fat, you're sedentary, there's no physical activity, exercise. I think if you lack exercise, weight-bearing exercises, strength training exercises, you're in for some trouble, for sure.
No, that's very well put, so like Dr. Akshat said, weight training. And it doesn't mean you have to go to a gym and lift weights, but lifting your own body weight is one of the best exercises for bones. Whether you do push-ups, you do squats, whether you lift weights, and, there are people who do it even when they're 50, 60, and 70. Yes, and that shows you how strong their bones are. So I think, in our country and actually around the world, Dr. Akshat, what I see is people are always like, okay, when I have osteoporosis, there'll be a medication. Or, if my bone breaks, I'll get a replacement done. If I crack my hip, I'll get a hip replacement done. Correct. They don't understand that the quality of life and several other functions that calcium is also required for gets completely, enhanced. So any other lifestyle tips or any tips you would like to leave us with? Definitely, please do not self-medicate yourself, because we've been seeing a lot of people do that. Everyone should see their doctor at least once in 6 months for a general checkup. And because everyone's deficient today, I take D3 myself, because no matter how much sunlight I get, I can never get my levels up to 50, 60, and I want it at 90. So I do take those. I take a D3, I do take calcium when I'm working out more because of age and everything else. So we need to understand these things are important. Everyone's just eating organic food, but no one's figuring out that it's about assimilation and absorption. Just because you're eating sesame seeds doesn't mean your bones are going to get stronger. You have to have phosphorus in the bones for all of that to work. So anything else you'd like to leave us with, Doctor?
So I think, see, whatever we discussed are the problem areas. So one is you got to change your lifestyle. I think it will again boil down to, your four pillars. Okay, your nutrition. It's not only calcium. So it's calcium, your vitamin K, K2. You're talking about magnesium. You're talking about zinc. You're talking about omega-3 and B12. Okay, so we can't leave the trace minerals aside and just concentrate on this. Then you want to look at proteins. Yes, proteins are extremely important, but don't let the carbohydrates go. So a lot of people do vegan diets. A lot of people do gluten-free diets. That's okay. That's a choice. But no one said carbohydrate-free diets. Okay. That's something that you're putting yourself into danger. So don't do carbohydrate-free diets. You can go low if you want to, but don't cut it out completely. Absolutely. I do believe that's the balance. Okay. Then second is exercise. Very important. The way you also mentioned weight training. If you enjoy it, there's no harm in it. But if you don't, something like a yoga also, where you're actually putting some tension, some pressure on your muscles, that will help you, because the more tension on the muscles, that tension even increases the bone density. That will help you. It's not going to help you in a month, 2 months. That's not going to work. You've got to be consistent with it. And there's one more very huge myth which says that senior citizens should not do weight training. That's not really true. Okay. That's absolutely not really true. What you need to understand is, if you've never done, okay, so there are two categories. A lot of senior citizens have done weight training in the past. These people can go ahead and start it. The only thing is, even whether you have a trainer or you don't have a trainer, you decide when to stop. Okay. You decide when to increase the weight. Don't, this has nothing to do with, we're not looking at hypertrophy of the muscle. We are looking at toning. We are looking at strengthening. Okay. So lower weights, more repetitions will actually give you better results, whether you're a senior citizen or not. So remove that, that thing mindset that, oh, I'm too old to start any form of weight training or exercise. That's not true. All you have to do is you have to be a little bit more cautious. That's all that you want to do. Okay. Third, most important, stop smoking. There's absolutely no alternative to smoking. I can't give you one. I can't tell you that you have a vitamin C and that will negate all that you are doing. I can't help it. So you got to stop smoking. Even if you don't stop alcohol, that's okay. But you got to do it in moderation. You got to reduce it. So you got to be very, very careful on smoking, drugs, alcohol. Okay. Then salt intake. It doesn't matter whether you're having pink, white. It doesn't matter which salt you're having, but how much. If you over exceed your salt, and when I say salt, it's not only what's going in your food, your packaged food and your aerated drinks, and everything has salt and sugar both. So you got to be very careful of your salt and sugar consumption. Okay. Aerated drinks, strictly as much as possible, let it go. Caffeine. Caffeine is again something which will leach out calcium from the bones. It's not worth it. It's not, and especially first thing in the morning, you're giving yourself a good acid environment, acidity, gut health, ruined, your bones are going to get ruined. So you don't want to go that way at all. Sleep. I think, Luke, you speak about sleep more than anybody in the world. Okay. But if you don't sleep, you don't recover. Your muscles don't recover. There's absolutely no rest for the bones. There's no way, the bones are going to feel good. You get up with aches and pains. You get up with feeling tired. It's not even worth it. So sleep, 100%. And I think very, very important, two last things. One is, don't take unnecessary medications. Okay. In this category, I'm not talking about steroids and all, because that comes from doctors, but antacids comes very, very strongly in this category. You have a problem, you have acidity, you have bloating, fix it. Don't depend on antacids. If you have hiatus hernia or something, reflux and all, that can be a different problem altogether. But having, obvious things that you're doing, not eating on time, eating bigger portions, lesser portions, eating late at night, mid meals, and this is what you want to avoid. Try and understand what is the trigger for the acidity and check that. Get the cause out, get off the antacid. That's very, very important. And last but not the least, this is very, 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 very important for senior citizens. Please don't fall. You have to prevent falls, okay? Wet surfaces, wet bathrooms, rainy season, terraces, multitasking, look at the phone and going for a walk. Please don't fall. You got to be extremely careful. It's not worth it. Yes, there is a medication available for osteoporosis, but it's still, if you need it, you need it. But if you can, avoid it, so be it. Because the first sign, you never even know about osteoporosis unless and until you have a fracture. So it's not worth it. Don't even go that side. Be careful, be more aware. You want to put grab bars in the bathroom and everything, go ahead and do it. There's no shame in that, but please be careful, avoid falling.
Brilliant points, Dr. Akshat. Thanks. And in case people still aren't convinced about lifting weights or their own body weight, even walking is considered as a weight-bearing exercise. So the more sedentary you are, the worse it is for your bones. But even when you walk, it's a weight-bearing exercise, which is good for bone mass and bone density. Dr. Akshat, thank you so much for all the amazing amazing points. And I think just to recap, I think we've seen just too many patients popping calcium and different brands and all of that stuff, and higher doses, higher doses. Please understand you're doing more damage. You know, speak to your doctors before you put anything in your body without any understanding. Thanks, Dr. Akshat, for your time. Have a great evening, everyone.